Rapid English, no cap. Yeah, Rapid English, no cap. Listen, learn, and you'll speak ASAP with Rapid English, no cap.
Hey everyone, welcome back to Rapid English, no cap, the podcast where we talk like real people so you can learn to sound like one too. I'm Lily.
And I'm Alex, and we are genuinely so happy you decided to spend some time with us today.
So today's topic is one that I think every English learner needs at some point. We're talking about handling a medical appointment, like the whole process, from the moment you decide you need to see a doctor all the way to picking up your medicine.
Yeah, and if you've ever tried to navigate a doctor's office in an English-speaking country, you know it can feel really overwhelming. There's specific vocabulary, there's a whole process you're supposed to know, and nobody really explains it to you.
Right, exactly. So today we're going to walk through it all in a natural, casual way, the way we'd explain it to a friend. And we're going to cover a lot of really useful vocabulary along the way.
Oh, and heads up, somewhere in the middle of this episode, we've got our textbook versus no cap segment. That's the part where we take a rule that your grammar textbook probably taught you, and we show you what's actually happening in real life.
It's honestly one of my favorite parts of the show, so stick around for that. You won't want to miss it. But first, let's get into the main topic.
Okay, so let's set the scene. You wake up one morning and you're just not feeling great. What do?
Honestly, I try to ignore it for like 2 days first. I drink some tea, I tell myself it'll go away.
Same, honestly. But okay, eventually you decide, all right, I actually need to see a doctor. So the very first step is booking an appointment. And that word, appointment, just means a scheduled time to meet with your doctor. You can't usually just walk in whenever. You need to have a specific time reserved.
Right. And a lot of clinics now let you book your appointment online or through an app, which is super helpful if you're still working on your confidence speaking English on the phone.
Oh, totally. But if you do call, the receptionist is going to ask you a pretty simple question, like, what's the reason for your visit? And that's when you start talking about your symptoms.
Yes. So symptoms. A symptom is any sign that something might be wrong with your body, like a headache, a fever, a sore throat, feeling tired all the time. Those are all symptoms. They're basically the clues that tell the doctor what might be going on.
Exactly. And you don't need to use fancy medical words when you describe your symptoms. You can just say something simple, like, I've had a sore throat and a fever for 3 days. That's totally enough.
Yeah, keep it simple and honest. Okay, so when you call or book online, they might also ask about your insurance.
Oh, right, insurance. So insurance is basically a healthcare coverage plan. It's something you pay into, either through your job or on your own, and it helps cover the cost of medical care. In a lot of countries, especially the US, having insurance is a really big deal because healthcare can be very expensive without it.
Yeah, very expensive. And they'll usually ask for your insurance card when you arrive at the clinic, so keep that handy.
And even if you have insurance, there's usually something called a copay. A copay is the fixed amount of money you personally pay each time you visit a doctor, even when insurance is covering most of it. Like, maybe it's $20, maybe $30. It depends on your plan.
Right, it's like your share of the cost. So it's good to know your copay amount before you go, so you're not surprised at the front desk when they ask for it.
Definitely. Okay, so you've booked your appointment, you've shown up, you've handled the front desk. What actually happens when you get inside with the doctor?
Okay, so usually a nurse will call your name and take you into a room first. They'll check your basic stuff, temperature, blood pressure, that kind of thing, and they'll ask you to describe your symptoms again. Then the doctor comes in.
Right, right.
And this is such an important moment for English learners because you need to explain how you feel as clearly as possible. There's a big difference between saying, "My stomach hurts," and "I have a sharp pain on my right side that gets worse after I eat." The more specific you are, the better the doctor can help you.
Yeah, that specificity really matters. And also, don't be embarrassed to say things slowly or ask the doctor to repeat something. They're used to it. They want to understand you.
Totally. Now, sometimes you're not going to the doctor because you're sick. Sometimes it's just a checkup. A checkup is a routine medical examination. Like everything might be totally fine, but you go in once a year just to make sure your body is healthy. Kind of like a regular maintenance check.
Yeah. Annual checkups are actually really important. A lot of people skip them because they feel fine, but that's exactly when you want to catch anything early.
For sure. Okay, so the doctor listens to everything you say, they examine you, and then they give you a diagnosis.
A diagnosis, yes. So a diagnosis is when the doctor identifies what's actually wrong, like they're putting a name on the problem. You have a bacterial infection. This is acid reflux. You have the flu. That conclusion, that's the diagnosis.
Right, and sometimes the diagnosis leads the doctor to say, "Okay, this is actually beyond what I can handle. I'm going to send you to a specialist," and that's called a referral.
Yes, a referral is basically your doctor's recommendation to see another doctor who has more specific expertise, like a cardiologist for your heart or a dermatologist for your skin. The referral is kind of like a formal introduction. It explains why you're being sent there.
Exactly. And a lot of insurance plans actually require a referral before they'll cover your visit to a specialist. So it's an important step. Don't skip it.
Good point. Now, in a lot of cases, after your diagnosis, the doctor is going to write you a prescription.
Right. A prescription is a written or digital order from a doctor that tells you exactly what medicine you need. You can't just buy certain medications off the shelf. You have to have a prescription. The doctor might hand you a physical paper, or these days they often send it electronically directly to the pharmacy.
And that's our cue to talk about the pharmacy. But actually, you know what? I think this is the perfect moment for our textbook versus no cap segment. What do you think, Lily?
Oh, yes, perfect timing. Okay, everyone, this is what you've been waiting for. It's time for textbook versus no cap.
Today's tip is all about double negatives. Okay, so your English teacher or your textbook probably told you at some point double negatives are wrong. Never use two negative words in one sentence.
Right, so the classic example the textbook gives is, "I don't know nothing." And they'll say, "Wrong." You have to say, "I don't know anything." One negative, not two.
Okay, grammatically in standard written English, sure. But here's the no-cap reality check. Double negatives are used everywhere. In everyday speech, in music, in TV shows, across tons of communities and regions.
All the time. In AAVE, African American Vernacular English, and in many regional dialects across the U.S. and beyond, double negatives are completely natural. I ain't got no time for that. Everyone knows exactly what that means.
Nobody is confused. See? I just did it. Double negatives are often used for emphasis, to make a point feel stronger and more real.
Totally. "I don't need nobody's help" hits differently than "I don't need anybody's help," you know? It's more expressive. Language is alive. It changes, it adapts, and it varies by community.
So for learners, yes, know the standard grammar rule. It's useful for writing, for formal situations. But when you're out in the real world listening to people talk, watching shows, listening to music, double negatives are not mistakes. They're a real, valid part of how people speak. Context and community matter way more than the textbook.
I love that. Okay, that is your textbook versus no cap tip for today. Now let's get back to our medical appointment. We were just about to head to the pharmacy.
Yes, the pharmacy. Okay, so a pharmacy is the place where you go to pick up your medicine. Most grocery stores have one inside. There are standalone pharmacy chains, and now you can even use online pharmacies that mail your medicine to you.
Right, and going to the pharmacy can feel a little intimidating the first time, especially if you're not sure what to expect. But honestly, the process is pretty simple once you know it.
Super simple. You walk in, go to the pharmacy counter, and you either hand them your physical prescription or you just give them your name if the doctor already sent it electronically. They'll look it up in the system, then they fill the prescription, which just means they prepare the medicine for you.
And they might ask you a couple of quick questions, like, do you have any allergies? Are you taking any other medications? That's just them making sure the new medicine is safe for you.
Yeah, totally standard stuff. And sometimes there's a wait, maybe 15 or 20 minutes, so a lot of people drop off the prescription and then go do something else while they wait.
Yeah, grab a snack, walk around the store, and here's something I think is really important. When you pick up your medicine, the pharmacist can answer questions like, do I take this with food? How many times a day? What if I miss a dose? They are literally there to help you understand your medication.
Yes, don't be shy about asking. That's literally their job. And if you're confused by any of the instructions on the label, just ask them to explain it in simple words.
Exactly. And the last piece of the puzzle is the follow-up appointment. So after you've been treated and you've taken your medicine, your doctor might want to see you one more time just to check how you're doing. That second visit is called a follow-up.
Right. The follow-up is basically closing the loop. The doctor wants to confirm, did the medicine work? Are you feeling better? Are there any new symptoms? Sometimes the follow-up is just a quick 5-minute check-in.
Yeah, and sometimes the follow-up leads to a new prescription or a referral to a specialist. It's kind of a cycle, but the more you understand each step, the less stressful it all feels.
100%. And I just want to say, even if your English isn't perfect when you're at the doctor or the pharmacy, the people there are used to communicating with all kinds of patients. They will work with you. They want to help.
Yes, and never be afraid to say, can you please repeat that? Or can you explain that in simpler words? That is not a sign of weakness. That is smart communication. Doctors respect it.
Totally. Okay, let's do a quick run-through of the vocabulary we covered today, just so it sticks. We had symptom, insurance, copay, appointment, checkup, diagnosis, referral, prescription, pharmacy, and follow-up.
10 words, and they all came up naturally, right? That's kind of the whole point of this show. You don't need to memorize word lists. You just need to hear words in context, and they start to stick.
That's exactly it. Okay, Lily, I think that's a wrap for today.
It is, and what a great episode. We walked through the whole medical appointment journey, booking your appointment, explaining your symptoms to the doctor, getting a diagnosis, maybe a referral, getting your prescription, navigating the pharmacy, and booking that follow-up. You've got the full picture now.
And we snuck in that textbook versus no cap segment too. Double negatives, people. They're not always wrong. Don't let the textbook fool you.
Ha! Never. Okay, to everyone listening, thank you so much. Genuinely. You could be doing anything right now, and you chose to spend this time practicing your English with us. That means everything.
We do not take that for granted, not even a little. If this episode helped you, even if you just learned one new word today, that is a win. Please share it with someone else who's on their English learning journey. Help us reach more learners out there.
And remember, learning a language is not about being perfect. It's about being brave enough to try and consistent enough to keep going. You are already doing that just by being here.
You're doing amazing. We'll see you in the next episode. Until then, keep listening, keep practicing, and keep being no cap about your English.
Yeah, Rapid
Take
English,
care, everyone.
No cap.
Bye.
Listen,
Bye.
learn, and you'll speak ASAP with Rapid English, no cap.